So let's talk about passive range of motion, or PROM, as you may see it spelled, which is the acronym for passive range of motion. So to assess your dog's joints, and this is a really good way to know what's going on, or if your dog's just had any kind of injury or surgery, what we're going to do is flex and extend. So when you flex, the lower limb goes the lower limb goes towards the upper limb. So if we want to do passive range of motion of, clearly he does not want that today. So for the carpal joint, we're going to flex. And what you want to see is the differences between two limbs. Maybe you need to be fired. So we just take it slowly. And we don't want to push it or bounce it. We just want to slowly bring it towards the upper limb. And we want to feel, what does it feel like between limbs? And then extension goes forward and flexion. So when we want to do his elbow, which is right here, we want to bring, hold underneath, keep it parallel to the ground, and bring it up. And notice that I'm doing it very slowly. I don't want you doing this because your dog will just, he won't like it and he'll try and leave. And I extend it away from his body and towards his body. And with all of these, you do it 10 times. But if you're using it as an assessment tool, you just want to see, the reason I put my hand under here is to feel, do I feel anything in there, like a crunch or a pop or a twang is one of the words I use when a ligament is passing over the bone in a weird way. So I'm just bringing it this way and back. Some breeds, they are very hypermobile, and you can do, like him, I can bring it all the way here. When you assess both sides and I do the other side, it's not a good idea to do it this way, but I want to see what is normal for him. So normal for him is almost being able to touch. Some breeds, you just won't get that. But if you have some arthritis in the carpal joint, you'll find that you may only get this far. And it just feels like there's a, we call it a bony block, but it's basically there's something restricting it, and you should not push past it. So passive means we're not stretching. Passive means if it was my shoulder, if I bring my shoulder here, it feels okay. I can feel a little bit of stretch here. But if I bring it further, I can feel stretching here. I can feel it in here. I can feel it in my scapula. So that's a stretch. And we don't want to do a stretch. We want it to be passive. So in his case, his shoulder joint is up here. And what we're going to do is just bring it forward a little. Like that. And then this is flexion, because it's going towards his body, is this way. And then this way. So that's the shoulder joint. And then if we want to do the hip joint, the hip joint is one of those joints, kind of like the shoulder, but it's one of those joints, if you do it too far or you hurt them, they'll never let you touch it again. So with the hip joint, which is right here, it's the little nubbly thing, the roundish kind of thing you feel there. You're just going to put your hand under the knee and just bring it back. And again, as soon as I feel any restriction, I don't push past that. In fact, I come a little bit forward out of that restriction. And then I bring it forward. And then I bring it back again. And I bring it forward again. And then with the knee, same idea. Bringing the hock or the tarsal joint towards the back. And forward again. If your dog has a knee issue or arthritis in there, they won't like this. Especially full extension or full flexion. And then the tarsal joint, this one is a little different in that you cannot flex it without flexing the knee. It's just because of the tendon, the Achilles tendon here. So when you flex it, you're going to have to flex the knee. And then you can extend it. Oh boy, what happened there? And then up. And then back. And you can see I'm going really, really slowly. Another way that you can do the hind limb for people, I have some clients that are a little bit afraid of hurting their dog. So I tell them to do something, I call it tickle toes, rub thigh. So you tickle the toes, which activates a reflex, and you get flexion, flexion, and flexion of the hip. And then, with a lot of dogs, rub it, rub-a-dub-dub, rub-a-dub-dub, oy. He says, what the hell? And you won't get full extension, but at least they'll stretch that leg out a little bit. It doesn't work as well on the front, but I find if you do that, and then tickle the toes, oh yeah, tickle the toes, and then rub, oh, like that. Yeah. And some dogs, they like it on their thigh. Others up here, it's just your dog will tell you what he likes. The only downfall with this is you can't actually feel what's going on in the joint. But in my mind, this is one of the best things to do to actually know what is happening in those joints. That's how I found out that Jake had arthritis in his hock, was because I went to move it, because I noticed he was offloading, and when I went to flex it, I could feel this thickening in here. I felt it in my hand, and I felt this little clunk. And when I had it x-rayed, he's basically got arthritis all around that joint. So that is how you do passive range of motion. And as I said, it's great post-surgery, but it's also a great diagnostic tool to see how your dog's joints are doing. If you're doing it just to assess your dog, it's not something you have to do every day, obviously, but it's something that you want to do on a regular basis. So every couple of months, every month, if you remember, and just see exactly what's going on in there. So that, my friends, is passive range of motion.